Anxiety attack causes and symptoms. Anxiety can occur when a person fears that something bad is going to happen. It is a non-medical term that refers to a feeling of fear or worry that often relates to a particular issue or concern. Anxiety has been linked to stress as well as feelings of fear and worry. It often involves physical symptoms such as muscle tension. It is different from a panic attack, which is a symptom of panic disorder. Anxiety often relates to a specific event or situation, although this is not always the case. A panic attack, meanwhile, can happen without any specifiable trigger, and the symptoms are far more severe than the symptoms of anxiety. However, if levels of stress and anxiety continue for a long time, further problems may develop. Symptoms of anxiety. Symptoms of anxiety include worry and apprehension, restlessness, sleep problems, difficulty concentrating, irritability, sadness, feeling pressure and hurried. Physical symptoms include changes in heart rate, tension in the head or neck, headache, nausea or diarrhea, sweating, dry mouth, tightness in the throat and difficulty breathing, trembling or shaking, feeling faint. Not every case of anxiety will include all these symptoms. Anxiety can be mild, moderate, or severe, depending on the trigger and how the person reacts to it. Faced with an examination, for example, some people might feel mildly apprehensive, while others may experience all the above symptoms. Usually, when the hazard or perceived danger passes, symptoms go away. Anxiety that continues for a long time or that is triggered by specific events may be a sign of another disorder, such as social anxiety disorder. Causes. Anxiety often results from stress or feeling overwhelmed. Common causes of anxiety include work pressure, financial pressure, family or relationships problems, divorce, separation, or bereavement, concerns about parenthood or being a caregiver, problems coping with administrative issues or technology, changing life situations such as moving house or changing jobs, reduced mobility or physical function, loss of mental function, for example short-term memory, having a diagnosis of a chronic health condition such as multiple sclerosis, diabetes, and others. It can also be linked to another factor or health condition such as social another phobia, obsessive compulsive disorder or OCD, post-traumatic stress disorder or PTSD, genetic factors, major stress or susceptibility to stress, changes in the brain, a history of drug or alcohol abuse, excessive caffeine use, the use of some medications, a recent or past traumatic experience. Triggers of anxiety could include public speaking, exposure to a phobia trigger, a fear of having a panic attack. Sometimes anxiety can also stem from a psychological disorder. Types of anxiety disorder. There are several different classified anxiety disorders. Each one features different types of symptoms that can, in some cases, be triggered by specific situations. panic disorder or PD. This involves at least two panic attacks accompanied by the constant fear of future attacks. People with panic disorder may lose a job, refuse to travel or leave their home, or completely avoid anything they believe will trigger an attack of anxiety. Generalized anxiety disorder or GAD. This is a constant state of worry about a number of events or activities in the person's life. Phobic disorder. This features an incapacitating and irrational fear of an object or situation. For example, a fear of spiders or open spaces. Most adults with phobic disorder are aware that their fear is irrational. Obsessive compulsive disorder or OCD. This condition is marked by unwanted, repeated thoughts or obsessions and behaviors or compulsions. Complications. The response that leads to stress and anxiety is designed to help us cope in difficult situations that arise temporarily. Adrenaline is the hormone involved in the fight or flight response. A sudden release of this hormone prepares the body to flee from danger or to confront the danger physically. Under normal conditions, adrenaline levels quickly revert to normal once the fear is removed. However, if anxiety continues and adrenaline levels remain high, further problems can arise. Persistent stress and anxiety can lead to other problems such as depression and anxiety disorder. Ongoing stress has been linked to problems with the immune, digestive, sleep, and reproductive systems. Physical health problems that may arise include frequent colds and infections, heart disease, high blood pressure, diabetes. It is important to take action or seek help to reduce stress and anxiety if it becomes overwhelming or persistent.